Johnson & Johnson says it's evaluating its vaccine against the new variant. It's looking to make a vaccine specifically for Omicron. Meanwhile, the company has also announced an agreement with South Africa's largest drug maker, allowing Aspen Pharmacare to make its own brand of COVID vaccines to determine who will get it. It's good news for Africa. The WHO yesterday said many donated vaccines are near the end of their shelf life. With me now is Stephen Saad, the CEO of Aspen Pharmacare, who's with me from Durban. Sir, good to see you. When you make this new vaccine, has the necessary, are we talking here about a window shopping exercise, or has the IP been transferred? Has the necessary technology been transferred for you to make this thing yourselves?
Thank you, Richard. I think it is, as you say, a great opportunity for Africa. So where we are right now in the step one is the critical part of getting independent. So the license gives us our own vaccine. We currently, as you know, make a J&J vaccine for J&J. So we are contract manufacturers, and where we are now, which is a different position, is that we'll be in a position to make a vaccine and not have to sell it to J&J, but rather sell it to Africa and the African Union. So it's quite an important step for a few things. One, it gives you independence, so we decide who we sell to. So vaccines made in Africa stay in Africa, and I'm sure you fully briefed on what's happened in Africa. And the second area, of course, is IP. We're talking about IP waivers. This way you don't need IP waivers, and the tech transfer gives you certainty of success.
Stephen, what do you need now, though? What actually is the next step that somebody like yourselves, is it VC capital? Is it investment? Is it production facilities? Is it technical know-how? What's your next biggest requirement?
I think we've invested heavily in our facilities, and where we really would like to go is to get our capacity up to 1.3 billion doses, J&J doses, because that would give us 1 dose per 1 African. We've built the infrastructure for that. We were at 300 at the end of this year, so our next step is to take it up to just over 400 next year and 700 the following year. I think for us, it's not about funding. It's more, you don't want to build, these big World Cup soccer stadiums that I see outside the window here, and, you use them once and then pandemic goes and it disappears. So I think a very important component here is to understand that multilateral procurers will support regional manufacturers. I think that's been pretty important.
So,
I think sorry.
So because we're just almost out of time, but I just want to get your view. Is it your view that Omicron, that the current, and I know we don't know, I'll give you, we don't know, but is it your view that Omicron, the current vaccines, will de facto do a good job at keeping it at bay?
Yeah, as you've answered the question, but I think what I can do living in South Africa is just give you some of the insights I've heard from some of the experts here. And their view at the moment, and it still needs another week or two, is that the cases they've seen have been largely asymptomatic and mild. An absolute best case scenario here is that it is very infectious, but the symptoms are mild and it's no more than a flu. That's the upside. The downside is it's a lot worse, and the next 7 days will tell us it's terrible. So we don't know, but there's been nothing to make us so alarmed at the moment that we should all start panicking, because the people have been largely asymptomatic.